At this point in time, I think most people out there are aware of cholesterol and bad cholesterol and LDL cholesterol and the close linkage with development of coronary artery disease and other atherosclerotic manifestations over time. It's true, of course, in healthcare, we all know it, but even just among the lay public, I think most educated folks are aware of that. Doesn't mean the message still doesn't need to get out there louder and to all segments of society, but in general, at least when I go to a party, I am often asked about LDL cholesterol that people have and do they need to do anything about it. What I think is much less appreciated is the role of the triglyceride in cardiovascular risk. And it's not that physicians don't know about that. I think it's they know about it, but sort of forgot about it. That is, triglycerides were in several years ago, but then there were a series of negative trials showing no benefit of drug therapy for elevated triglycerides with respect to lowering cardiovascular risk, and then triglycerides were out. But I would say triglycerides are back in again, so it's important for physicians to know that and measure it and pay attention to it and act on it. But it's also important for patients and just people out there to add that to the list of potentially modifiable risk factors independent of LDL cholesterol and other risk factors. And the first line of attack with elevated triglycerides is lifestyle modification. That is diet, exercise, weight control, weight loss. A lot of times some caloric restriction and getting on a healthier diet and losing some weight will do the trick. In people that drink too much alcohol, restriction or elimination of alcohol can help reduce triglycerides. And sometimes people may not think that they're drinking too much, but for their system, it might be too much and lead to triglyceride elevation. And there are also a variety of other lifestyle and medication side effect issues, thyroid issues. So it does require screening by a physician for secondary causes of hypertriglyceridemia. But then when all that basic stuff has been done, if the triglycerides still remain elevated in patients who otherwise are also at elevated cardiovascular risk, there is a potential role for statin therapy. And when that doesn't do the trick, most recently now we have added to our armamentarium icosapent ethyl, which was studied in the REDUCE-IT trial and found to reduce cardiovascular events in patients with high normal to mildly to modestly elevated triglycerides if they had additional cardiovascular risk.